Has AI meaningfully created efficient systems where we can start tackling these problems?
In leaps and bounds.
Wow.
This is the golden
Yeah.
age of AI. I think the companies that can integrate not just efficient coding models that you can get through AI, but also really understand how to create a flywheel effect around the problem. Because you can generate a lot of kind of like analytics, but is it scalable? That's the other thing. And is it
Mhm,
incremental in value?
mhm.
Because next time you might be dealing with a different set of providers. So what CareShield AI for us we do is for our clients,
Gotcha.
we automate all the rules and edits across the country as they are happening in real time. So now when the client comes to me, I can provide the same edit with an update 6 months later and also additional dollars that I found based on that increment. So I'm always adding incremental
Mm,
value, ways in which you can implement yeah. Now there is also a part where, when there's a clinical part which requires a human being, but a lot of that as well is using generative AI. So, you can ask inputs, you've got dashboards that are very efficient to use. But this is, yeah, companies that are focusing, this AI is really opened the door for significant improvements in this space.
Super interesting.
do yeah, there's so many questions, but do if you kind of, I guess, have anything you want, or if you want to see the government kind of improve, what would that even look like? What can they provide you to let you do your job better?
Well, I think right now, I think you want the government to create the focus. So,
Uh-huh.
and I think this is why I'm applauding the government currently because the government is the biggest corporation in the country. And if they show a certain focus on something, companies pay attention, right, to what the government is doing and where they're paying attention, they're spending most of their time. So what I would really want is to have the letters, Dr. Oz sent 50 letters. That's the first thing that I would want, because then it would really put the spotlight on the entire country, and then we actually benefit everyone, right? And then this is the first thing. And then once that happens, I also think, make the RFP process much quicker, much faster, and open to new companies. A lot of times there's a bias where, a lot of these RFPs, and I understand, these are big contracts, so the government needs to know that you can deliver the
Mhm.
service and you're
Yep.
not going to
Mm, I
corrupt.
see.
But I think part of it is also opening up innovation, just like in the military world, right? You see them opening up drone companies that are not legacy, Boeing or other, they're bringing in new
Correct.
companies to create, and we're now seeing the benefits of that sometimes on the battlefield. And that's the same thing here, right? The government has to be open to having conversations to growing companies like us, right? And say, hey, you guys have a focus on this. Let's really work with you. And in some of these states, show us what you can do, and we can expand across the entire country.
Yeah, I mean, so many great points. Awesome. This has been such an incredible
Conversation. Yeah,
conversation.
this is awesome.
Yeah. You make me feel like what I do is not very important. Like, I'm really proud of, like, what you're doing. I think it's a really great service. I think it's really important, right? Like, it benefits everybody at the end of the day to be able to, like, detect and reduce fraud, waste, and abuse in any system, particularly the healthcare system, right? Where we know healthcare costs are really crushing people across the world, right? Not just the United States, not just in
Sure, Canada
Canada,
as
but
well.
healthcare costs are everywhere, right? And
Canada
they just
is
keep going
Canada
up, you
is
know?
let me tell you something. Canada is one of the worst at this because our insurance companies, they don't handle a lot of the claims because a lot of it is covered by the government, the medical cost.
Mhm. Right.
So,
Mm,
only $48 billion is spent, by commercial plans. So if you are Manulife, $48 billion and you have a slice of that for pharmacy, dental plans, etc., you have hundreds of billions of dollars in pension funds and other things. So
Totally.
the resources sometimes that are allocated to some of these services is bad. And one thing, if I were to speak to our Canadian audiences and even stakeholders, is hey, we need to have a better reporting system. The US is so good at reporting
Yeah.
instances of fraud, waste,
Yeah.
and abuse. You cannot
Wow.
even
Okay.
figure out who has been banned or not in the system. And I think
Yeah.
that reporting, that standard is of transparency allows people to see like, hey, there's opportunities to create innovation in this space and we can add value.
Yeah.
So I think the US is, I would say, ahead by quite a bit in terms of how they report, how they focus on this issue. And one of the incentives, again, is because some of these big healthcare companies make billions of dollars through the government and healthcare spending. So it's an incentive for them to actually, find efficiencies and savings.